During the press conference, the Prime Minister Dr. Edouard Ngirente stressed that the decision to take these measures was made after careful consideration and that it was made with the best interests of Rwandans at heart. When thinking of these measures during this battle we are fighting of the pandemic, we first thoroughly think through them because we're thinking of both the virus but also the livelihoods of Rwandan people. That's why when we say movements are prohibited, we don't stop the transportation of foodstuff essential products because we know provinces depend on each other when it comes to foodstuff, but these cars should limit the number of persons traveling in them. We should respect the guidelines all together and beat this together. The Minister of Health, Dr. Daniel Ngamije, said that in the last 4 weeks, the number of COVID-19 cases has risen sharply and about 90% of them had no symptoms. We had space in hospitals that are dedicated to people suspected of having infectious diseases, but we also have specific hospitals for COVID-19 treatment. The numbers have been on the rise recently in June. For instance, at the Nyarugenge Treatment Center, at the beginning of June, we had less than 20 patients. Currently, there are over 127 patients. Generally, the number of patients has increased, and in the treatment course includes giving them oxygen because it's a requirement for some of the COVID-19 patients, among other services we give them. What's evident is that tests have increased tenfold in the hospitals. Dr. Ngamije also reiterates that health authorities are continuing to closely monitor the situation. In regards to the new variants, research is being done. An Indian variant is being discovered in the neighborhood countries. It wouldn't be a shock if we also got it here in Rwanda. It's very possible because the virus keeps mutating. But what's important is adhering to the prevention guidelines. Because we know how this virus spreads, we know it kills both the young and the old, those with chronic diseases and those without. But also know that we can avoid all that if we respect these measures. Health authorities say the virus is mostly prevalent in 14 districts of the country. Among the new measures that have been taken this Tuesday that will take effect on the 1st of July include a curfew of 6 p.m. to 4 a.m. in Kigali and other districts where the virus is prevalent, with places of worship closed in districts.
Thank you, Sam Kalisa. Staying on the same note, the Ministry of Local Government is urging people to avoid all activities that encourage social gatherings, especially in their homes, citing that this is one of the main causes of the spread of the coronavirus. This is after a big number of those infected currently got the virus from visiting others under the guise of praying for them. The Ministry of Health estimates that 95% of the more than 9,000 people currently infected with COVID-19 as of Tuesday don't have any symptoms, and most of them are under the home-based care. We decided to treat them from home, and we are working with local authorities to follow up on them. This is something that we've been doing before, and so we work with the Ministry of Local Government to establish those that need help beyond just the medical care that we provide. However, the Ministry of Local Government says that there are some people that have been phoned to go visit these patients that are in the home-based quarantine under the guise of going to pray for them. We have seen cases of people who are under the home-based care having people come over to their homes to visit them and pray for them. Only health counselors are allowed to visit COVID-19 patients. It's wrong for people to go dance, sing, and pray for the COVID-19 patients because that's how the virus spreads. So the local authorities have a responsibility to check on these people to find out what they might need and assist them under the guidance of the health authorities. The Rwanda National Police indeed acknowledges that they have arrested some people caught in people's homes who later tested positive for the virus.
indi myumvire itari myiza ni nkaho usanga
most of the people the police has arrested for going beyond the COVID-19 prevention measures are those that have gone to visit each other in homes and others that hold house parties. And these people often test positive for COVID-19. And so that's the perception we're trying to fight of how one can leave their home and go spread the virus to other people without knowing their status. The Minister for Local Government is urging people to avoid such activities as local authorities have found out that such are the root causes of the spread of the pandemic. He relates this to people on social media that have been seen asking that no strict measures should be put in place, including a lockdown. The only way we can avoid the total lockdown is by adhering to the prevention measures, because if all people got sick in the country, then no one would be able to treat the other. This is the time for reflection for all Rwandans to see how they can protect themselves and their loved ones. An example is a lady we saw in a certain district whose child got infected from a school and then the virus spread within the family. So the only way is to really take care by wearing your face mask and fulfill all the measures. The Ministry of Health estimates that the number of new cases has increased fourfold this June, ultimately leading to an increase to those being treated in hospitals needing special care.